Welcome back to another episode of Rehab Now with consultant physiatrist Dr. Paula Dawson, our rehabilitation medical doctor, and I am your host, Alicia Taylor. Hello, Doc.
Hello, Alicia.
Yes.
How are you?
I'm really great.
Yes.
I'm stress-free.
It's a good day. Good day.
Yes, remember you can check out our social media pages, Rehab Institute Caribbean, Dr. Paula Dawson, Alicia Taylor Music, that's for Instagram. For Facebook, it's Rehabilitation Institute of the Caribbean, and our website, rehabcaribbean.com. So today we're talking about stress fracture in sports.
Not stress.
Not stress, but stress fracture.
Stress fracture.
You understand?
In sports in particular.
Yeah, so Doc, I gotta explain
Yes.
what causes the stress
Stress
fracture.
fracture.
Or
Okay.
what is a stress fracture?
All right, so from one of our previous episodes, you would remember we mentioned stress fracture. And a stress fracture is a tiny crack that is in the bone. So it's a hairline fracture, hairline breaking the bone. And this is usually as a result of repetitive action, repetitive activity, repetitive pounding, repetitive lifting, because you don't necessarily have to be running to get a stress fracture. It could be a thrower. We're going to talk about some stress fractures that javelin throw may get in their back, or volleyball. You can get a stress fracture in the back, something called spondylolysis. Spondylo is just a fancy word for the spine. So you get spondylo.
I feel like you like the terms, you know.
No, man. You always hear people say, I have spondylosis. What is spondylosis?
Okay,
This is not what
I've
we're
heard
talking
that
about.
before.
So spondylosis is arthritis in the spine. It is arthritis in the spine. So it's degenerative changes in the spine. That's spondylosis. What does that mean? Decrease space in between the vertebral bodies by the discs losing their height, and then the vertebral bodies coming closer together. And then there's a joint. There are joints in the back called the facet joints. And the facet joints will become arthritic, right? But that's not what we're talking about, spondylosis. You get age-appropriate spondylosis progression. So 40% of 40-year-old, 50% of 40-year-old will have MRI changes showing spondylosis. And if you want to do an MRI, you do it at
Winchester
MRI. Right. And so, but that's not what we're talking about. We're talking about a type of fracture that you can get from sport called spondylolysis.
Okay.
Lysis means almost like a break, right? So you can get a stress fracture in sports from repetitive jumping, repetitive running. As I told you, any activity that can do hyperextension of the back. So when you lean back, so if you're going to throw a ball, bowlers in cricket can get it, volleyball players can get it,
Basketballers can get it.
basketballers can get it, gymnasts can get it, because sometimes they arch their backs all the way, right? And you can also get stress fracture in sports in your lower limb. You can get it in your hip. You can also get it in your leg. Remember, we spoke about the shin stress fracture, which is the tibial stress fracture, or the fibular stress fracture. You can get it in your heel, the calcaneus bone, and you can get it in your foot, the metatarsal bones. Right? So you can get, those are the areas that we commonly see stress fracture in sports. Right.
So what does that mean?
All right. It's a good question. What does that mean? All right. So which one are we going to start with? All right. So when you're playing a sport, right? I'm a sports medicine doctor, and I travel with a team, and I see a lot of our international athletes. And almost inevitably, when you do an MRI, I remember when I was in Germany with the team for World Championship, and we had one of our athletes, she was having a knee issue. And we went to, this is early in my days of practicing, this is 2009 it was. And we were there with a sports medicine physician. He was the head of the Germany contingent medical team. And we're still in contact now, Dr. Babak. And it was the first time I was seeing an MRI, of course, with what we call stress reaction. So I want to mention that because stress reaction is where you see changes in the bone and the bone marrow before a stress fracture.
Before.
So when you pound and pound, I've seen a lot of athletes since when we do MRI, you get a stress reaction. So what is a stress reaction? Almost like a bone bruise, an inflammation in the bone. And so when I used to live in New York, I used to play squash a lot, right? And I used to play squash and my left ankle started to hurt. Every time I play squash, my left ankle, the inside of my ankle hurt like crazy. When I did an MRI, I had a bruise on the inside of my ankle. They call it stress reaction or bone edema. So it wasn't yet fractured, but it was an inflammation that's saying, hey, you're pounding too much, or your biomechanics is off. And so a stress reaction is where it's telling you, listen, you're stressing me. It's either you strengthen me, you rest me, or you stabilize what's going on around me.
Are you going to break me?
Or it will break, exactly.
Okay.
So if a stress reaction is untreated, it can progress to a stress fracture. Right.
My God.
So a stress fracture is a crack, a small break, hairline break in the bone. And so it as I mentioned, it can happen from overuse injury when you're continuously impacting on it, doing usually weight-bearing activities. So people think that weight-bearing is when you walk. It's not only when you walk. You can bear weight when you extend. So you put weight, put pressure, right? So you put pressure under the spine. So where do you commonly see these fractures? As I mentioned, the tibia, which is the thigh bone from the knee to the ankle, the big bone on the inside. Then the little bone on the outside, the fibula. And then after that, you can get it in your heel, the calcaneus. That one is very, very painful. You can get it in the metatarsal bone, which are the bones in your foot, from your ankle to just the base of your toe, right? You can get it there. And you can get it in the vertebral bodies in your back, right? And that's the spondylolysis. I talk about fracture in the spine. And you can get something called compression fracture.
Oh, that one, that's
right. So compression fracture is not so commonly seen in athletes. It can be seen in older athletes. Why? Because compression fracture happens when your bone is not as dense, when you're losing density in the bone. So let me segue and just speak about compression fracture a little bit, unless you have a question.
No, it's just that when I heard compression, I thought about
something squeezing down.
Yeah.
And that's exactly what it is.
Okay.
Imagine that you have a styrofoam, piece of styrofoam, and you step on it, and it squishes in. That's exactly what happens to the bone in the vertebral body. So the vertebral bodies, when you look at them on x-ray, they look like a square.
Okay.
But what happens when they become compressed, one part of it gets squeezed down and it now looks like a triangle.
Oh, wow.
Right. And so compression fracture.
Oh, that's really compressed.
That's really compressed. And so you can actually get it most commonly seen in older folks when they become osteoporotic, meaning they get osteoporosis, where the bone density decreases, or osteopenia. So osteopenia is where the bone density is less, but not as bad as osteoporosis. And osteoporosis, when your bone is so thin and it is more prone to you fracturing it. So the older you get, so when your bone gets thin, so anything, like when you have something that is dense, it is stronger than something that is not dense. So the bone density is less in people with osteopenia, and especially with people with osteoporosis.
And so these are the different types of...
Right. The common ones, the location that you commonly they see them. But the thing is, who can get it, right? And what are the risk factors? Age. The older the athlete, the more likely to get it. And of course, why? Because...
To get the stress fractures or specifically compressed?
Stress fractures in general. Because if you have because remember, you have... I think one of the reggae marathon in Jamaica, there used to be this little old man who used to always run. Me sure would have beat me still, But the point I'm making is the older you are, you still have people who are running.
That's true.
And so the older you are, your bone is not as dense, not as strong as younger people.
Yeah,
one.
It used to be.
Right. If you have a high BMI, which is basal metabolic index. So if you have a lot of weight on you, if you're heavy, if you weigh a lot, more than you should for your height. So a bit of overweight can also lead to stress fractures. So you're pounding more because you're carrying more weight, especially on your feet, right? That can happen. You can get stress fracture when your anatomy is off. And what do I mean by that? Especially in your feet. The reason I had gotten the stress reaction in my ankle is, I don't know if you remember in previous episode, I've mentioned that my left ankle is pronated. So every time I went to play squash, it turned in, and it was playing squash was squashing my ankle. That's what you're laughing, don't
That's
it?
funny.
So biomechanics, exactly. So my anatomy was off, and it was causing that biomechanics irregularity, right? And so also the surface, if you have improper surface, again, you're running on a hard surface, as opposed to like when some of our national athletes start running, doing their sprints, they go from the grass and they go on the synthetic track. So some will train at Stadium East, some will train at the stadium. Some of our high schools, thank God, now have the synthetic track, which is kind of softer and allows for more training without the pounding on the hard concrete pavement, right?
Right. I can go ahead.
Yes, of course.
So the stress fracture. How do I know I got the stress fracture? Just by pain.
Just by pain.
That's it.
Good question. Pinpoint pain. So you have pain when you weight bear. So if you don't put weight on it, it doesn't necessarily hurt. But when you hop, like if you have it on one side and you hop, you have pain. So that's a very, very good question, because sometimes patients are going to say, why is it a stress fracture versus a sprain?
Yeah.
Exactly, right. So you have pinpoint tenderness. And remember from one of our episodes, especially if it's a tibial stress fracture or the fibula, the pain is worse as you run. So it's worse when you run, but it eases when you rest, usually. But if the stress fracture is so inflamed, you may have pain at rest.
Yeah.
But the minute you start running, you feel the pain
again.
Right. And so, as I mentioned before, the risk factor for that, again, is more common in women than men, females than males.
Always.
And of course, you have the thinning of the bone from osteoporosis or osteopenia. But that's a good point, where it is more common with when you are running. That's when you feel the pain and you have pinpoint pain.
So how does that, I mean, I'm sure I know it off the top of my head, but how does that affect an athlete's performance?
Oh, wow.
We know said probably them naga can run, or they probably naga can do it.
But remember, one of our athletes, one of our long jumpers, had an issue with a stress fracture and was unable to perform in the last World Championship because of that stress fracture. But once you have pain, you can't perform. You understand? Once you have pain, you can't perform. So the more you train, the more you have pain. And then you become deconditioned because you can't prepare.
Oh no, we're going to have to take a break. When we come back,
Yes.
we finish up this and then we go to treatment.
Yes.
So stay with us.
Yes.
Welcome back to Rehab Now. If you're just joining us, we're talking about stress fracture in sports. Okay?
Yes, ma'am.
And we were just basically going through the intrinsic.
Yes. I like that.
Thanks.
That's very smart.
Thank you very much.
So there are intrinsic risk factors or causes, and there are extrinsic.
Yeah.
So intrinsic is what about you. So your age, your weight, your gender, female more than male, your medical issue, whether you have bone density or when you have biomechanics, anatomical problems. So the extrinsic now would be the environment.
Yep.
For example, the surface you're running on, incorrect surface, incline, whether you're running uphill, downhill, or on a slope. Your footwear, where your footwear is wrong, you don't have good support for the footwear. Your poor diet, so if you don't have enough...
Poor diet,
yes. Decreased calories, one. Vitamin D deficiency will lead to decreased bone density.
Oh, well, that makes sense.
Another thing that's interesting is if you have young athletes, like really, really young, and you start training them for a specific sport too early, they can be at risk, more risk for stress fracture. What do I mean by that? If you have a young child and you don't cross-train them, so you just have them, for example, you just have a gymnast and she's just doing gymnastics.
That's it, nothing else.
Nothing else, right. So the rest of the body doesn't get to develop. So if you have when you're early specialization in a sport, you tend to get that. Repetitive activity, that's key. Repetitive. Those are the extrinsic, the environmental factors. Those are the things that will cause an increased risk of stress fracture in sports. Yes. Extrinsic factors.
So we talk about the risk factors.
Yes.
Talk about the symptoms.
Yes.
Are we going to talk about the treatment?
We can talk about the treatment. Well, I want to talk about the treatment, but how do you diagnose? We forget to mention that. Why are you laughing at me, Alicia?
You were going to say it. I just knew you were going to say that.
Okay. So the question...
How do we diagnose it?
Yes. Good question. History as a patient.
Yeah.
A few things. But you need to
Ask them about the type of pain. Sorry.
Yes, ma'am.
Sorry.
Ask them about the type of pain. That's true. But also, in addition to that, you may want to do some x-rays. Interestingly...
That's what you do first?
That is what you do first.
That is... Okay.
Right. Because if you suspect it from the history, you have to do an x-ray. Because you don't want to miss a stress fracture.
True.
Because it can progress to become a frank fracture, a big bone fracture, where you can have dislocation, where you can have movement now, rather than it being a hairline fracture. And you do an x-ray. Now, the thing with x-ray, 2/3 of the stress fracture, if you x-ray too early, you'll miss it.
So then...
You're going to miss it.
So then what can we do to not miss it?
So you can either wait. Well, not wait. So a lot of times when the athletes come in, it's usually like 4 weeks after they've been struggling with the symptoms. What you see on the x-ray will be, you may see the hairline fracture, or you may see the body starting to heal. So you may see a little bit of callus or lump around where the fracture is, thickening on the bone. So if you're looking on an x-ray, so right where you think the fracture is, you'll start seeing thickening right there. So visible healing, you'll see that on the x-ray. If the x-ray is still not showing anything, then you can do a bone scan, or you can also move to an MRI.
I was going to ask about that.
Yeah, man, an MRI. So what do you do? Well,
glad you asked.
I'm glad you asked. So you had asked me about treatment. So you want to rest.
Oh, okay. So you don't want to protect, you just want to rest. Because if you protecting can...
I like that, You see, I think I should be the host and you should be the specialist.
Come on!
So protection is a part of the price algorithm.
Yes.
And protection is important. Why? Because you prevent yourself from further damage. And how do you protect in this instance? Some patients that have stress fracture may need casting, plaster Paris.
Yes, I know that.
Or they may need, so nowadays, instead of putting on the plaster Paris, they have these big black boots. You always see people with them, the cam boot. They actually, you've seen them, man. So these big black, like chunky snow-looking things that they wear on the snowshoes-looking things that they wear on their foot. So they call them cam walkers. So some people will wear that. Some people may have to get crutches to protect, to offload. I'm glad you mentioned that.
Yeah.
So that is, you want to protect it and then you rest it so you don't put any pressure on it. Because a bone will start healing. You start seeing healing after like 6 weeks. You start seeing stickiness. That's what actually we'll call it, where the bone fibers start becoming attached in terms of its healing at about 6 weeks, right? You want to do that. Of course, you want to give pain medications.
Sorry. I'm going to make it finish. Go ahead.
Some doctors may not give anti-inflammatory, like non-steroidal anti-inflammatory, because, in the literature, it says that it slows down bone healing. So they tend to give more acetaminophen, which is like over-the-counter acetaminophen for the pain control.
All right, my gosh. So in the process of price, do we do everything in price? Because when I think of compression, I'm thinking of pressure on the fracture.
Right. So that's a good point. So say, for example, the fracture is in the metatarsal, which is in the foot, and the foot is swollen.
Yeah.
You can put on bandage to kind of bring the swelling down. Yes, you certainly can apply compression there. If you have a fracture like in the back, the spondylolysis, we didn't even mention what spondylolysis is.
We did-ish.
We did ish. We certainly did. But let's double back. So spondylolysis, we have to mention it. So
Mention it.
there's a part of the vertebral body, you're going to laugh, called pars interarticularis. It's just a special part of it's almost like the neck of the vertebral body, right? And right there where the neck of the vertebral body is, you can get a crack.
Jeez.
You literally get a crack. So athletes that do a lot of hyperextension. So javelin, so you go to throw the javelin, you hyperextend. Cricketers, when they go to bowl, they hyperextend.
Yeah.
Right.
True.
Volleyballers will get it.
Hyperextend.
When they're going to shoot.
Okay.
No, serve. It's serve. You're serving volleyball, right?
Serve, shoot. No.
And the gymnasts, especially because, those gymnasts, they really hyperextend.
Oh, yeah.
So those patients will have more pain with hyperextension. And when they lean forward, the pain eases.
Oh.
Because you take the pressure. So you're no longer loading what they call the posterior elements. You're offloading when you lean forward.
Got it.
And so once they lean backwards, they get that pain, that sharp shooting pain in the back. But there's some other things after the price. So after we do the protect with the cam walker or the plaster Paris cast, and then you rest it and then you ice it, because ice is very good because it's a way of quieting inflammation.
Nice, yes.
Right, and you compress if you want to bring the swelling down and elevate it. We can actually use something called a bone stimulator. Yeah, man. So there's this thing now. It's an electrical equipment where we put some electrodes around the bone and we run a low voltage current or ultrasound through the bone to promote healing.
Low voltage current.
Low voltage current. So you've been to the therapy, right? When you go to rehab into the Caribbean, they'll put these little sticky things on you and they turn it on and it kind of shocky, or it kind of makes different ones. You have TENS, transcutaneous electrical nerve stimulator, or EMS. Or you have these little sticky pads, like when somebody go to ECG,
yes,
and they stick on the pads on you. Those are called electrodes.
Thank you.
And then you have a little wire that goes to a little transistor, like a transistor pocket, look like a phone, a small size phone, and you turn on the knobs. And you feel like a little buzz around the electrodes on your body.
Look at you with the layman terms. Come on.
Yeah, man.
Good job.
You buzz it up. So you put these electrodes.
Buzz it up.
Buzz it up. So you put these electrodes around the fracture, and it can give low voltage current or very low ultrasound, which is ultrasound, to the area. So you don't want too much ultrasound, because if you put ultrasound, guys, if you put ultrasound around it, you can shake up, for want of a better description, you can mess with the neovascularization. So in healing, what you feel? So in healing, you have a lot of bleeding, but in healing, you have new blood vessels kind of going back in and forming. Thank you for that word. But so you want to promote that. But if you do too much ultrasound, it can cause interruption of the blood vessels. So it's low voltage electricity, low current electricity, and low intensity ultrasound. These are special bone stimulators that promote growth.
So if the sound is too intense,
yes,
can it worsen?
Yes, absolutely.
Fracture?
As a matter of fact, I'm glad you mentioned that. So when I was in New York and I got the stress reaction, before I did the MRI, I went to the physical therapy department. I diagnosed myself. I tell them to put ultrasound on my ankle. Remember me tell you, oh my goodness, I felt so much pain. So the ultrasound actually made it worse. Oh, no. So if you have a stress reaction, meaning the ultrasound that they use for treatment in therapeutics, you do not use that on a stress fracture, early acute stress fracture, or bone reaction. I can actually remember the pain now, and I know exactly where I was in the hospital in Brooklyn because I was visiting.
And you told them to put it on.
I tell them to put it on. It is not them.
And why are you diagnosing yourself?
Because I didn't do the
you're
MRI
not the doctor
yet.
at the time, but you're not the doctor in the room.
I never did see a doctor.
You know what?
But if I'm in a sports medicine program and I'm the musculoskeletal specialist in training, me no must can diagnose.
Why not diagnose and treat myself?
Trust me, man. I felt so much pain. So that's an important thing. You want to make sure you go to somebody who knows what they're doing. So make sure you see a medical doctor. Either come to me, the physiatrist, the sports medicine doctor, musculoskeletal specialist, or you can go to an orthopedic surgeon or another sports medicine trained doctor, because we have a lot of sports medicine trained doctor. The University of the West Indies have a program, master's program. So if you are interested in sports medicine, UE has a master's program that you can actually register for sports medicine. So you can do it once you have a medical degree. Also, they have it for physical therapists too.
Oh.
It's a master's in sports medicine. All right. So, but guess what? If that fails, sometimes they need surgery.
Oh, a long time without the surgery now.
It's a long time we don't mention surgery. So I have had athletes with fracture of the thigh bone, the big one, that will need screws and plates, and then they do bone grafting to try and promote healing, right? And even in the spondylolysis, which is a fracture of that area called the pars interarticularis, which is that the neck part of the vertebral body, they can put little pins in it to promote healing. And the reason for the pins or the screws is to keep the section still, so it don't move up and down, so the bone can heal back.
Okay.
Yeah.
Awesome. Thank you very much, Doc. But one thing, how can stress fractures be prevented, or can they be prevented?
Absolutely. They can be prevented by, one, if it's extrinsic, you treat those things.
Yeah,
right
environment.
footwear, avoid excessive surface changes or incline in the surface. Make sure you take your vitamins. If you have bone density issues, strengthen your bone density, lose weight so you're not heavy too running. You can't change your age, and you can't change, well, I'm not so sure you can, well, let me stay away from that one as it relates to gender. But you can treat the intrinsic as much as you can, like the weight issues and the osteoporosis. You take your calcium and your vitamin D and the extrinsic fracture.
I'm so sorry. Thank you.
You're
But that's all
most
we have time
welcome.
for.
Yes.
Thank you, producers, the engineer, everybody. Rehabilitation Institute of the Caribbean, providing medical care for function and performance in association with Winchester MRI, Jamaica's first choice for MR imaging. Denk Pharma, a combination of key active ingredients designed to boost the body's natural defense, and Almighty Studios, a recording studio where we create worship music to praise, to worship, and to serve. Our sponsors, thank you. That's all we got time for. Blessings.
Blessings. Bye.